How long will bars stay in for most people and why?
So how long bars stay in is, I guess, recommended differently by different physicians. In my older adult population, 30s and up, my concern is always regression. And there isn't good data out there in, groups of patients followed out 10, 20 years to say how long is long enough. So in my mind, I always would rather err on too long and someone not having a regression than not long enough. If you look at big studies in teenagers, and everything is out there is in pediatric populations, if you take bars out at 2 years, you have about a 15% risk of regression. If you wait to 3 years, it's less than 5%. And then if you go further to four, it probably drops down another percent or two. There is a law of diminishing return. If you keep bars in too long, they create problems. They get encased in bone, they get encased in scar, they start eroding through the sternum, eroding through the ribs on the side. Your risk of taking them out become higher the longer they're in there. So there's probably a sweet spot. And for most patients, I say 3 to 4 years. And I push them towards longer, the older they are or the deeper they are. If you have a connective tissue disorder like Marfan's or Ehlers-Danlos, those can also affect your ability to make scar, and you have a much higher regression risk. So in those guys, I recommend at least 4 years, sometimes up to 5 years.